Okay, so welcome to week 6. So today we're going to start off by doing quiz 4. It's in your grade book, so you can access it through that. It covers week 6 content. Um, After that, we'll review the quiz. And then we will go through the content we didn't cover from the quiz. And then we're going to break out into breakout rooms and do the case study on community health education. Okay, so that's the way today's going to go. Does anybody have any questions? This is week 6, so we have the review sessions this week. One already happened this morning. Professor Ford did hers this morning. I'll do mine on Friday at 11 a.m. Eastern Time, and then Professor Kershaw does hers on Sunday at 6 p.m. Eastern Time. And that's on the master schedule that you were giving at the beginning of the term. Okay? Does anybody have any questions? You'll get all the recordings. Okay. I haven't received Professor Ford's recording yet, but as soon as we get it, I will forward that on to you. So next week at this time, you'll be taking exam 2. I've already met with quite a bit of you to review the concepts missed in exam 1. There's still a few more people I'm waiting to hear from. I do have some appointments scheduled as well. So if you haven't reached out to me, please reach out to me. Okay. Does anybody have any questions before we get going? Okay. Why don't you go ahead? It is 1:05, so we'll go till 1:20. Why don't you go ahead and take quiz 4, and then we'll come back in about 15 minutes and review that. Please don't forget to hit submit when you've finished it. Okay. So I'm going to go ahead and mute people that aren't muted. I'm going to mute myself. Laura, do you mind muting yourself? I'm not able to mute you. Thanks. How's everybody coming? Is anybody still working on the quiz? Josephine, are you done? Okay. How are you done? Give it a few more minutes here. Sorry. Everybody done? How many more do you have, Josephine? 2 more? Okay. Let me know when you're done. Okay, if everybody could come back on camera, we'll go ahead and review the quiz. How'd you do?
I thought number two, one of their answers was very difficult to decide whose personal feelings. Is it the nurses or the people that are the vulnerable population's feelings.
Well,
That answer was,
let's bring that up when we get to the question, okay? But I know that there's one question that we'll talk about when we get to it. Okay, I'm going to share my screen. Okay. We'll go through the quiz. Can everybody see my screen? Yes? No?
Yes.
Okay.
Yes.
Okay. Laura, is this the question, the first one?
no, it's the second one.
Oh, okay. All right. So which statement is not true? Hopefully you saw the not true about vulnerable populations. What's the right answer to this?
Vulnerable populations have lower mortality rates than the general public.
Because they have higher, right?
Yes.
Higher, as does all the rest of the answers. Vulnerable populations often have poor health outcomes. That's a correct statement. They have higher rates of communicable diseases. That's a correct statement. And they're exposed to higher levels of crime and violence. That's a correct statement. So good job for number one if you pick C. They actually have higher mortality rates. Number two, which of the following should be the initial or first consideration made by the nurse who's working with vulnerable populations? We talked about this several times last week. So it's
Is there B?
B. B is the correct answer. It's not that the other answers are not correct, but it's asking what is the first thing that we need to do when working with vulnerable populations. I think I mentioned this at least 3 or 4 times last week. We always have to have an understanding of our own feelings, our own biases, our own, if there are any, perceptions, right? Before we're able to care for vulnerable populations, understanding our own feelings. As far as the other answers, A would be if you're working with the vulnerable population of the LGBTQ, right? Assessing the family structure within a homeless family, that would be for working with the homeless population. And then the last answer, D, would again be working with an example of working with the LGBT population. But this is a example of a question that if one or more answers look correct and it's not a select all that apply, please go back and read the question and see if there was an important word or phrase or cue that you missed. So this is asking what is the first consideration, initial. Laura, does that help?
Well, it would have been better for me if they actually would have put your own personal feelings, because the way it states, it doesn't state if it's the personal feelings of the people that you're working with or your own. So that's what was confusing to me.
Okay. Okay. All right. That's good feedback. But it's implied that we're talking about our personal feelings. Okay. Let's get to number 3. Nurse Sarah discusses discharge with the new nurses during orientation. Which statement by one of the new nurses will she need to correct? So what kind of question is this?
I'm sorry, so I have a question. To go back to the previous one. So it's so since it doesn't give like a topic or anybody, like it doesn't name anybody by name, we should assume that it's talking about us.
With which one? B?
Question 2. Yeah, for
Yeah.
B.
Understanding of personal feelings of working with members of the vulnerable population.
So I'm saying as in like the questions like that, we're supposed to consider them like when they're just very broad, that they're questions regarding ourselves and just like basic knowledge, or
Say that again. Say that again. So I make sure I'm understanding you.
okay.
Uh-huh.
So understanding of personal feelings of working with members of vulnerable population. So I think I got the answer right, but I mean, I was still kind of tripped up on that because it doesn't really truly give any detail on, like, are we talking about ourselves? Are we talking about the other people there? So when it's asking a broad question like that,
Mhm.
should be initial consideration made by a nurse. It should be like, you know, understood that the question is like self-reflecting on us.
Well, the question's asking the consideration made by the nurse. Okay, so the implication is, what does the
And the
nurse have to
nurses us, right?
what does the nurse have to do initially? What's the most important thing that the nurse first has to do? And that initial step is to understanding their own personal feelings with working with vulnerable populations, if there are any conflicts in caring with certain vulnerable populations.
That would have been better though, because even when you're saying it, you're saying own, because I understood that question as, or the answer as, understanding the vulnerable people's personal feelings while I'm working with them. That's the way that I took that answer, because the word own was not in there. And
Okay.
we do have to consider, so that was a kind of a hard one for me to
Well,
determine on which one to
okay.
answer.
Okay. All right, thank you for that feedback. I appreciate it. I'm looking at it as the nurse who's working with the vulnerable populations. Therefore, we're asking what her or his or her consideration should be, understanding your own personal feelings. So maybe I can change the language in that going forward, understanding of their own personal feelings, the nurses understanding of the nurse's personal feelings. Is that
Yeah, that would be much better to be
okay?
able to see what side it goes to, because that was kind of very misleading for me. Because I was
Okay.
thinking, well, we do have to think about their personal feelings while we're treating them.
Well,
So
I'm also going back to how many times we talked about this last week, right? And when we were talking about vulnerable populations last week, and we mentioned several times about understanding your own personal feelings. So it was a carryover into this week. Okay.
It was also a question on last week quiz, guys, similar to this. It was talking about, the LGBT community, and it was similar to the same question.
And understanding your own personal feelings.
Mhm.
Yeah. Okay, I appreciate that discussion. Thank you. Whoops. Nurse Sarah is discharging a patient. Oh, hang on. Nurse Sarah discusses discharging a patient with a new nurse during orientation. Which statement by one of the nurses will Sarah need to correct? Ignore that blue dot. I don't know why that blue dot is there. So what is the correct answer here?
Number 4.
Right. We know that discharge begins. Oh, no, I'm sorry. I take that back. What kind of question is this?
It's about the discharge planning.
It's a negatively framed question, which means, what does the new nurse say that is either incorrect or needs some re-education, or is just not it's not correct? What does that nurse say that's not correct? Right? Which statement by one of the new nurses will Sarah need to correct? The answer is D.
Yes.
Discharge begins once the social worker receives the instructions to set up home health. Why is that incorrect?
Discharge begins on admission.
Exactly. Exactly. Okay, so this is an example of a negatively framed question where you're looking for something that's said that is wrong or needs to be retaught. Question 4, a patient is newly diagnosed with diabetes. The patient will need insulin injections. Patient is unsure of how to administer the injections? Which reply by the nurse will gain more information from the patient?
D.
D.
D is in dog, right? Because we'll get into this when we talk about the content, but we have to explore the patient's feelings. If they're uncomfortable with something, if they're unsure, if they're anxious, right? Have them share what are they uncomfortable with? What is their anxiety? Right? Because that's what guides your teaching. Question 5. Sam is being seen in the clinic today. He's a high school graduate, and there's several pages of discharge instructions. The nurse can assess his ability to read and comprehend by doing which of the following?
B.
B is in boy, right? Graduation from high school, A. Graduation from high school doesn't guarantee comprehension. Okay? We don't, C really doesn't matter. When did you graduate from high school? And we wouldn't ask D, right? That's kind of a judgmental question, right? So one of the ways we assess whether the clients can read and comprehend is asking them to read something and then discussing with, not quizzing them on what they read, but discussing with them what it is they read and how they understand it so we can assess comprehension. This is a question number 6. This is a question that everybody's going to get full credit for.
Yay.
Okay, I had a nice discussion with my Monday group yesterday about this question. And yes, it does give partial credit, but I determined that this was something I was going to give back. Let's talk about this. So we know that Lisa knows that low literacy is a learner-related barrier. Which of the following statements by the client indicates the client is experiencing a learner-related barrier?
B, C, and D.
All.
It-
All.
That's
Pardon
what I
me?
said. B, C, and D.
D.
B,
A,
C,
B,
and
C,
D.
and D.
Correct. And so I only had marked B and C as correct answers, or D is a correct answer.
Mhm.
All right, so I'm going to be giving full credit for this. Okay? Do we all understand why these are learner-related barrier statements? Okay, we don't know. They may say, I don't like to read, just tell me what I need to know. Well, maybe they can't read,
Mhm.
right? I'll figure it out. Just tell me what's important. Maybe they can't comprehend. Okay. So low literacy, we'll talk about a little bit more in depth, but one of the most common barriers to learning is low literacy. Question 7, the nurse may conduct an assessment of the workplace itself, which is known as a worksite walkthrough survey. Direct observation will allow the nurse which of the following? Select all that apply.
All.
All.
All of them. All of them.
I didn't understand all of them because I picked 2 of the answers, which was A and C.
Okay.
What got me was if you're walking around observing, how are you going to figure out the requirements of various jobs? You don't know what they're
Good
doing,
question.
how they're doing. They didn't act. You're not acting anybody, you're observing.
Right. But one of the jobs of the occupational health nurse is to be aware of what the job descriptions are of the employees,
Okay.
right? They are responsible for knowing what risks are in the job description, what education needs to be done. They are
Okay.
responsible for knowing what each employee is required to do. Let's say you're working in transportation services, you're working in food services, environmental health services, the operating room. right? Everybody has a different job descriptions with different requirements.
Right.
And so the occupational nurse needs to have an understanding of what these job descriptions entail so they can ensure the safety of the employee and the safety of the patients they're taking care of. Okay, and these are 4 different requirements. They have to have an understanding of the work processes and the materials that are used in the work setting. Are there chemicals? Is there special equipment that requires special training? What their requirements of the job are? Somebody in transport services needs to have a good training and education on lifting and transferring,
I
right?
think the
Present.
word walkthrough is what got me. I think that what was threw me off.
I was thinking the same way though. So.
Okay.
You want to see? Yeah. I think
Hazards, they need to
walkthrough,
be
yeah.
aware of hazards in the workplace. And they need to be observant of how the workers are practicing within their job description. Are they lifting correctly? Are they transferring patients correctly?
I got
Okay.
it.
Question 8, Mary the nurse knows that there's no safe environment, safe occupation and profession. One of the regularly scheduled primary prevention that Mary will implement. So this is a primary question, primary intervention. What's primary on this list?
Prevent
A,
a prevention of something happening.
Right.
Education.
So what's the answer? Provide safety education. Right? We're trying to prevent something before it happens. What's B? Primary, secondary, or tertiary?
Tertiary.
tertiary,
Okay. What's C?
Secondary.
Secondary.
What's D?
Transfer to injury.
Yeah.
It would be
That's still tertiary.
primary, no,
It's still
tertiary.
tertiary.
Yeah.
Yeah, they've had an injury, right? That's going to require surgery. That's tertiary. Question 9, which step of the ethical decision-making process is identifying the ethical issues in the situation?
A.
Yeah. Think of your nursing process. In order to go through the ethical decision-making process, you have to have an issue, right? You can't go through a decision-making process if you haven't identified what the issue is. And then question 10, the home health nurse is working in the community with high rates of complex chronic illnesses and neurological disorders. Which environmental characteristic is a priority? This is about environmental health.
B,
B.
B. Right? Part of environmental health and risks we'll talk about here in a minute is the environment, the community that you live in. And if you have a community that has high rates of illnesses and neurological disorders, what's contributing to that? Well, they may live in an environment that has several manufacturing plants near the community's river. That's a big issue. That's a big risk. And we'll talk about that here in a minute. Does anybody have any questions? Okay, so let's just go through the content. Okay, occupational health. That is workplace. Occupational health is located in the workplace, all workplaces, whether it's restaurants, banks, hospitals, long-term care facilities. Every workplace has standards of occupational health practices. So it's up to the nurse or whoever is contracted for occupational health to work with that organization, whatever organization it is. Like I said, it could be a restaurant, could be a hospital, could be a rec center, could be every workplace has occupational health and safety standards. Okay, and then nurse is responsible. This was one of your questions about knowing about work processes, right? What are the requirements of various jobs? What are the potential hazards? What are the work practices of the employees? And one of their jobs is also to observe for their safety education, their safety practices, their use of equipment in the correct way. Another aspect of the workplace could be clients or employees that are injured on the job, right? Or have been diagnosed with illnesses on the job. The occupational nurse works with those employees. For example, let's say there's a job injury on the job. Somebody's hurt their back. They have to go out and have back surgery. Okay, the occupational health nurse is part of that process. She becomes the case manager, right? Where she's going to be working with the employee, making sure the paperwork's done, working with the physician, discharge, coming back. Are there restrictions? Does re-education need to happen? Okay, and as we stated, no workplace is completely risk-free. Every single industry has risks for serious hazards related to work. Occupational nurses are health educators as well. They can do primary intervention things, programs, education on how to manage your chronic diseases. They may do education with clients or employees who have substance abuse issues, mental health issues. They do a variety of things. Really important role in organizations, the occupational health nurse. Okay, managing the care of injured workers. Work-related injuries. What about non-work-related injuries? They have to manage when that employee can come back to work. Working with HR, working with PT, working with OT. Okay. Like I said, they also do counseling and intervention. Big organizations have programs called EAPs, employee assistance programs. Has anybody ever heard of those?
Yes.
Okay. Where employees can seek resources, seek help. Okay, so occupational health nurses are involved in primary interventions, which is prevention. They're also involved in secondary interventions. They screening. Let's say it's a loud plant that makes cars or makes equipment. Very loud plant. Okay, secondary. Are they screening employees for hearing issues? That's just an example of secondary. Okay, that's why they have to be aware of the job descriptions and what risks different employees have in different sectors. And then tertiary. Maybe they're working with clients who have mental illnesses. Maybe they're working with clients who have substance abuse issues. Maybe they're able to refer them to programs. Excuse me. Maybe. Sorry. 1 second. 1 sec. Sorry about that. Just getting over this pneumonia and still have quite a cough. Another aspect of tertiary prevention, working with employees who have chronic illnesses. Maybe they have issues with obesity. Maybe they have issues with hypertension, diabetes. That occupational health nurse works to make sure that employees can manage their diseases. I mean, the goal is to have people at work in full capacity, right? So absences are looked at. Why are people absent? Are there trends? Are there, has there been an issue with, let's say, COVID or pneumonia or the flu? Occupational nurses monitor all that. Everybody's heard of OSHA, correct?
Mm-hmm.
Everybody knows what OSHA is, Occupational Safety and Health Administration. Okay. Federal and state regulations are put forward by OSHA. They're regulations, laws that affect the workplace. Right? One example is the FMLA. Right? The HIPAA Act. OSHA's job is to make sure that employers are in compliance with the regulations, the laws, the guidance that OSHA has set up. They're kind of the enforcers, right? They make sure that health and safety guidelines, laws, regulations are in compliance. And then they also, let's say there's an issue. Let's say there's an unexplained death in the OR, or there's been a number of falls by employees or clients, or there's been an issue. OSHA will come in and investigate. Let's say there's been a chemical spill, or a number of employees have been exposed to a certain chemical. They will come in and look at this and try and figure out what happened, do an investigation, what happened, who is at fault, and what re-education needs to take place, or what protocols need to be changed. So again, occupational health nurses, they have to be able to identify any kind of safety hazards, monitor them, make sure that all the staff that is involved with any kind of hazard is properly trained. Okay. Some primary, secondary, tertiary examples. Here, I'm down here. Maybe primary, teaching coping mechanisms, provide healthy diet education, teaching on proper lifting, using a proper protect PPE. And again, I gave this example: screening for hearing loss, blood pressure screenings, screening for stress and burnout. This is all part of the workplace. Tertiary, something's already happened. Maybe they have to help develop a limited duty return program for workers coming back to work. Maybe if another example, somebody's gone out had surgery for carpal tunnel. Do they have the appropriate equipment with them when they come back to work? Do they have a back splint? Do they have a wrist splint? That occupational nurse is responsible for all that. Questions about the occupational health nurse. He or she plays a pivotal role in workplace safety, workplace education, workplace safety, workplace training. Environmental health. Just stop for a minute and think about the environment you live in. Okay? Think about all the potential environmental risks that are in your community. Think about if you live in a community that is near an industrial waste site, a dump site, and the risk that poses. Think about if you live in a community is a transportation hub. You live near an airport, live near highways. Think if you live in a community with high rates of crime, and violence. You live in a community that is near water. Think of all the potential risks that are in all of our communities. Has anybody ever seen the movie Erin Brockovich?
Mhm.
What's that about?
That's where she fights for the people that got sick in the workplace.
What do they
remember.
get sick from?
I think it was-
Contaminated water. Right? Contaminated water. It was an environmental disaster. And not many years back, we had the water contamination up in Flint, Michigan. Right? We know that environmental hazards are responsible for over 1/2 of the total burden of disease in the world. They contribute to 80% of the communicable and non-communicable diseases and injuries. That's a lot. We know that children are much more vulnerable to environmental hazards. Why do you think that is?
Because their immune systems aren't completely built up.
Exactly. It's one of the reasons. What else?
Immature liver.
Well, and they don't, I mean, they don't have a lot of advocacy going on. You know, what if they're in schools that are older? What if they're in daycares that are older? Right? What if they're living in homes that are much older? There's asbestos and there's lead, potential lead exposure. It can also affect pregnant women in fetal development, exposures, environmental exposures, chemicals. Right? Environmental health can be determined in a few ways: genetics, socioeconomic status, environmental exposures. Right? Those who live, the vulnerable populations who live in poverty, they may be more exposed to environmental risks due to poor living conditions, maybe living closer to hazardous waste sites, having poorer quality foods available to them, maybe having more high-risk jobs, the older homes. There also may be a genetic predisposition, right? What if there's a family history of developmental delays, autism, asthma? So there is a portion of this that's genetically predisposed. When you're doing a environmental assessment, let's say you're the home health nurse going in to do a visit, and part of your visit is an environmental health assessment. What are some important things that you need to know? You need to know where they live, what kind of community they live in, where do they work, where do they go to school, where do their kids go to school? What's their dietary history? Do they eat a lot of fish? That high levels of mercury? Are they exposed to, one of the students brought up yesterday, she was in a community that last spring they were having issues with a certain mosquito, and trucks were just rolling down the street, spraying anything and everything.
Mm.
And then they were told they had to stay inside for the rest of the day. I mean, think of all the potential exposures, right? Think of everything we have in our homes or in our garages or in our storage units that's a pesticide, herbicide, that is a chemical that, if not handled properly, could create problems, right? A good way to do an environmental assessment is also doing a windshield survey. A windshield survey is exactly what it says it is: looking through your windshield. You're driving around, whether you're in your own car, in a public bus, whatever, walking around with your dog, walking around, doing an assessment. What does the environment look like? Is it in proximity to factories or dump sites or major transportation routes? Is it an older community, a newer community? Is there trash buildup everywhere? Or is the trash picked up on a routine basis? Are there pest rodent problems? If you live in a rural community, we already talked about the spraying of pesticides. We already know about lead-based paint before 1978. Pesticides used in homes, schools, daycares, hospitals, lawn care. All those are environmental risks. We know that 30 million Americans drink water that doesn't meet the EPA standards or safe drinking standards. Okay, when we think about the quality of the water, it's tied right into the quality of the soil. You know, what about building a new development? We've got to make sure it's not an old waste dump site and the soil's contaminated. Okay, we know that 50% of Americans live in areas where the air quality doesn't meet the national standards. Cars, the greatest single source of pollution, followed by the burning of fossil fuels. Okay, waste incineration is another huge environmental risk factor when it comes to air quality. Think of poor air quality potentially leads to all sorts of health issues, respiratory issues, cardiovascular issues, immune system issues, reproductive issues. Okay. Then we often don't think about food contamination as an environmental risk. When I go to a restaurant, when I drive up to a fast food, I expect that everybody from who's preparing my food, serving my food, is doing it correctly. Right? They're following all the proper safety protocols. But what happens if you have an outbreak? People get sick because employees didn't prepare their food the right way, have it at the right temperature, store it at the right temperature.
Wash
Big
their
issue. Pardon me?
Wash their hands.
Exactly. But we do have the right to know about things. Okay, it's called Consumer Confidence Reports. Okay, they are available to any member in the community. The other interesting tidbit here is we all know what the EPA is, the Environmental Protection Agency, right? That's responsible for the rules and laws and guidelines. If you go on the EPA website, you can actually plug in your zip code and it will give you what the most common environmental risks are within your zip code. Okay, so environmental health is really, really important in community. If you're working out in the community as a nurse, you're always going to be doing assessments of environmental risks because every community has them. But I don't know about you. I just don't routinely think about, I think the air quality is okay. The water's okay. Any of you make those assumptions without even thinking twice about it? I do. Not so much anymore, but what about the rest of you? What kinds of environmental risks are in your communities? Anybody? Nobody has any environmental risks in their community?
Electrical wires, pesticides.
Yeah. Okay, let's move on to health education and teaching. Okay, we know that patient education is one of our most important roles as a nurse. We use education in a multitude of ways. Primary level, secondary level, tertiary level. We use education to promote health, try and prevent illness and injury, try and improve health-related behaviors. And we try and teach and enable patients and their families to take responsibility for their health decisions and their health care and their diseases, right? We know that when we educate clients and families to take personal responsibility for their health, they're much more likely to change their behaviors if they feel that personal responsibility, right? We know education in general empowers patients with the knowledge and motivation that helps them take personal responsibility. We are educating in every role. It doesn't matter where we work. Every one of us are educating in our own way in every different setting. This was one of our quiz questions that talked about one of the most important learner-related barriers is low literacy. Right, with all the different cultures and the diversity we have, we are bound to take care of clients that have low literacy, families that have low literacy. Okay, people may be embarrassed to admit that they can't read or they can't comprehend. They may appear to us as, head nodding. They understand, right? But do they? Right? So back to our quiz question, one of the ways that the nurse can assess the client's ability to read and comprehend is having the client read some kind of printed instruction in their primary language and then discuss those instructions. If you ask them, can you read? They may just give you the yes, but you really have to do an assessment of that. And the other thing is with families, a lot of times we want the families to interpret, if there's a language barrier, right? But how do we know the families can comprehend what we're saying? Okay. How do we assess the patient's readiness to learn? Are they motivated to learn? Are they motivated in changing their behavior? Are they motivated to try and return as much as they can to independence and taking care of themselves? So we need to be able to assess motivation. And we all know patients that are very into trying to improve their health, and we know others that don't care. Right? So what is their motivation to learn, to understand, to be taught? We talked about this last week a little bit about culture. It is our job to understand different cultures, what their beliefs, expectations are, what their values are, what their practices are. How much of all of that can we incorporate into the health plan? Okay, the more we can incorporate their cultural practices into the health plan, the better things are going to go. When we talk about teaching, patients often express of lack of self-confidence. I'll never be able to do that. And here was the quiz question that talked about exploring the feelings. Why do you feel that way? Why do you feel like you couldn't give your insulin injections? Exploring their feelings as we're trying to develop a plan for how to teach them. What we assume may be their feelings or their defiance or their non-participation, maybe something very different from what actually is going on. Is there a language barrier? Is there a literacy barrier? Right? Is there an anxiety barrier? We know that we all learn in 3 different ways, as does our clients, patients. Some people are visual learners. They like to see something. Some like to hear something, auditory learning, hearing. And then the other is kinesthetically, hands-on, performing the task. Yes, I'm a kinesthetic learner. Like if I get stumped with my clicker and I have to call one of my kids because I can't figure anything out, I can't listen to explanations on the phone. I need to hold it and figure it out. I got to do hands-on. I'm not a good visual learner either. So we all possess all three of these, but one is usually pretty dominant. Whether you're a visual, a hearing, hands-on. Okay? There's three different domains to learning. There's three different domains to each of us, how we learn. Cognitive, affective, and psychomotor. We all possess all three of those. Okay, and what are they? Cognitive is the thinking part used for learning. It's the ability to hear information, read information, understand it, memorize it, and use it to solve problems. That's the thinking part. Affective is the feeling part. How are we feeling about the topic that we're teaching? Okay, what are and how do the people that are participating, the learners, how do they feel about it? You know, what are their attitudes, feelings, beliefs, values? You know, you're much more apt to learn about something that you value. Let's say you're being forced to go to an in-service on something that you have a attitude, you don't have a positive attitude about, or you have different feelings about, or different beliefs about. You're much less likely to learn. And then the psychomotor is the hands-on. It's the moving part, right? It's practicing and experimenting. You know, the example is a glucometer. When teaching kids how to use their glucometers for new diabetics in school, it was hands-on. They had a glucometer, I had a glucometer, and we did it that way. Okay, it's way easier to learn with hands-on experience that you can practice over and over again. Used to teach kids giving their own insulin injections, right? Give them a needle, give them a pillow. Let them practice. Okay, so that's psychomotor learning, the doing. Okay, you have to be able to, in your patient education or client education, whether it's in the hospital with a patient or in the community with a group of people, you have to expect that you are going to have visual learners, auditory learners, and kinesthetic learners. You also have to expect that in your group, some are going to be cognitive learners, affective learners, psychomotor learners. So how do you plan health education programs with all these different variables? It's kind of like you have to know your room, right? Know who you're teaching. Okay. Reinforcing education. Right? We know the ultimate goal of patient education is to prevent illnesses, promotion of wellness, and restoration of health. Right? Whether it's we're working with a patient prior to surgery, making sure they understand everything going on, what to expect. Whether you're working with people with chronic diseases, whether you're working with kids in school that have asthma or allergies or diabetes. We practice education in every setting we're in. And when we think about education, think about the nursing process. We do an assessment to figure out what kind of patient education needs to be done. We set our goals and objectives of what we want to accomplish. What's our plan? And we implement our plan. And we evaluate how well did we do. We talked about this in one of the quiz questions, that discharge planning requires starting that process on admission. right? What are these patients going to need upon going home? Thinking about that admission, are they going to need equipment? Are they going to need PT? Are they going to need OT? Are they going to need help with their medications? Are they going to need special equipment? Okay. So some examples of primary, secondary, tertiary with regards to patient education. Primary, some general examples. Teaching a woman to go to the bathroom before and after sex to prevent cystitis. Teaching parents how to role model healthy eating. Educating parents on immunizations. Secondary prevention with regards to education. Maybe teaching an elderly woman the signs and symptoms of a UTI. Self-screening, because we know that elderly women are at higher risk for UTIs. Maybe providing education as somebody's preparing for a colonoscopy. Providing education on the importance of pap smears and the schedule of pap smears. Then tertiary, again, they already have to have something. Maybe we're working and teaching a client or a group of clients what's a low sodium diet for clients that have hypertension. Demonstration of a glucometer for people with diabetes. Okay, talking about side effects of new medications. Okay, so there's a lot to be said for patient education. A lot to be said. We're always educating. It doesn't matter what setting we're in. It doesn't matter where we work. A clinic, a hospital, right? The home, a neighborhood urgent care. We're always doing patient teaching. It's one of our biggest jobs in nursing, right? Does anybody have any questions? I want to break us out into, you got to pull up the case study. I sent that in the week 6 announcement. Somebody in the group has to have the case study pulled up. Okay, it's in the week 6 announcement. I think it was the first attachment. The second one was the notes. We'll pull up your case study. So if you're in room 1, you're going to have question 1. Room 2, you're going to have question 2. Room 3, you're going to have question 3. So I'm going to put you into breakout rooms for 5-10 minutes. Come up with your answer, and then we'll review the answer and the rationale. And then when I send you the recording for this class, I'm also going to send you the case study that has the answer and the rationale in case you want to review it. I'm a big believer of rationales in learning. All right, so I'll send you the extended version. So somebody pull up the case study. I'm going to break you out to rooms, discuss your question, and then we'll come back and talk about it. Does anybody have any questions?
I only see one announcement for week 6 study materials.
Okay. It should say case study.
Nope,
Yes, it does.
I think it is.
not on mine. I don't have one on there for
Pardon
this
me?
one. But my internet's really messing up. It might
It's
just
in your,
not have-
it's in your week 6 announcement. I sent two attachments at the bottom of that announcement. One was your week 6 notes, and the other one was the week 6 case study. Has anybody else seen that in the
Oh, there, I
announcement?
see it now. Sorry,
Oh,
yes.
okay. All right, I'm going to get you all into these rooms, and then I'll see you in a second. I just assigned you to a room.
Mhm.
Do you guys figure it out?
Yes.
You already done? Okay. All right, great. Did you guys figure out your question?
No, we have the second question, right?
Yeah. Have you guys talked about the second question yet?
We were about to.
Somebody
Um,
have the case study pulled up on their computer?
yeah, I do.
Okay.
It's I was trying to figure out the answer too, so
Well, does everybody want to come off mute and talk about can everybody see the
Josephine,
study?
can you share? You
um
Case study on my end.
be able to share?
you want me to read it?
You can read it.
Okay, so it says Mr. Miller creates an educational program for the second graders at his school. His topic is related to exercise and fitness. What would be appropriate educational objective? One is each child will participate in the education. The second one is each child will participate in 30 minutes of exercise per day. The third one is within 2 weeks, each of the children will be able to demonstrate at least two exercises that they have learned. And then the last one is the children will verbalize understanding of instructions given. And I've been trying to figure it out, but I don't know, kind of.
So why don't you guys discuss that
Maybe
for
A.
a minute or two, and I'm gonna go into another room, okay?
Okay.
Okay.
How you guys doing? Did you come up with your answer?
Yes.
Okay, I'm just waiting for one group. They're almost done, and then we'll bring everybody back in.
Okay.
still waiting for people to come back, but I'm gonna share my screen and pull up the, no, wrong one. Hang on. Okay. Okay, everybody see my screen?
Yes.
So here's your case study. The nurse is providing education to students, parents, faculty with the intent of providing individuals and groups with the tools to make informed decisions about their healthcare needs. Health education in school is aimed at promoting healthy habits, lifestyles, preventing illness, and teaching measures to identify problems at an early age. An important factor in this process is for the nurse to set an example in terms of weight management, physical activity, and lifestyle choices. So room 1, the school nurse is working in the elementary setting. What is one of the first steps in creating an effective educational program? What's your
Okay.
answer?
C.
C. Why is it C?
Well, we have to identify what the group needs to know,
Exactly.
learn about.
Exactly. First, you have to identify what the needs of the group are, right? Before you can plan a program. One of the core principles is identifying the learning needs, right? Because you obviously want to create a program that is designed to meet whatever their needs are, or whatever the problem is in the population, right? Do they need to be educated on something? You know, for the preschoolers, do they have to be educated on good hand washing? For the primary schools, maybe they have to be educated on bike safety, wearing a helmet. For the adolescent population, maybe seatbelt safety, drug prevention, unintended pregnancy education. Okay, good job. Number 2, room 2, Mr. Miller creates an educational program for second graders at a school. His topic is related to exercise and fitness. What would be an appropriate educational goal? What's your answer?
We choose to. I mean, I'm sorry. We
Okay, so let's talk about this.
C.
The answer is C. Within a
Yeah.
couple of weeks, each of the kids will be able to demonstrate at least 2 exercises.
Mhm.
Okay, let's talk about objectives in teaching. Okay, objectives are considered specific short-term criteria, right? Objectives are set out towards achieving long-term goals, such as number C. That's an objective. Within a couple of weeks, the kids will be able to demonstrate at least 2 exercises. Okay, they're written statements, whatever your intended outcome is or expected changed behavior. Okay, objectives when you're planning programs, planning education, objectives need to be stated in measurable terms. So within a couple of 2 weeks, children should be able to demonstrate at least 2 exercises. They have measurable goals. What's your objective? What do you want to get out of this program? Okay. Number 3, what did you guys come up with in room 3? Did you come
Well,
up with
that
A?
could- Yes.
Okay, why? Why?
Mm,
Because he's doing the things that he's teaching the kids not to do.
Exactly. So that lacks credibility, right? So we talked about learner-related barriers today, but this is an example of an educator-related barrier, right? We're not all perfect. All of us that are teaching clients all the time, we're not perfect. There can be a lack of credibility with respect to a certain topic. Like I think Maina just said, he's teaching us things that, well, what he's doing, he's not walking the walk, right? So this is an example of an educator-related barrier. Okay, we can always try as educators, which we all are, increase our confidence by carefully preparing our program, our talk, our in-service, our meeting, carefully preparing ourselves and educating ourselves on the topic. Right? We don't want to say, apologize for lacking expertise on the topic we're trying to teach. There's no credibility there. All right, we have to lead by example. All right, so while we talk about learner-related barriers, there are educator-related barriers that we need to be aware of as well. You know, we teach in so many different settings. We have so much to think about in patient teaching, client teaching, whether it be the topic or the environment or the age, the literacy level, how they learn. Are you teaching people that are visually impaired, hearing impaired, disabled? There's so many things to think about as we educate, right? So, questions? So hopefully you can get to a review this week. If you can't, we'll be sending out the recordings. If anybody needs help before next Tuesday after going through their preparation for the exam and you still have questions on different concepts from weeks 4, 5, and 6, please reach out. I'm happy to review anything with you. I've really enjoyed my one-on-one meetings with a lot of you after exam 1 and weekly meetings that I have set up. I've really enjoyed my time with you guys. I appreciate your engagement and your enthusiasm, right? We all got to get over the finish line with this class, right? We'll get there, but you got to reach out if you need help. And I mean that sincerely. Promise I got your message in the chat. We were in the breakout rooms, but I got your message. Any questions? Okay, so that's it for me for week 6. If you want to stay on and ask me any questions, that's fine. You know where to find me if you need some help, but it was nice to see everybody and I hope you have a great rest of the week.